steroids for long term and in high dosage is osteonecrosis. When we use the word necrosis, it simply means destruction, death, putrefaction of bones, and it is a serious problem. It needs urgent care if it happens. So you have to visit the doctors, generally orthopedic surgeons. They will be able to take care of this problem promptly. But it is also very important to get it diagnosed very early. This is real serious issue with the long-term use of steroids, and it is much more like serious in the senior persons. If you see what are the bones that are mostly affected by osteonecrosis, the pattern here is very clear. It affects hip joint, knee joint, ankle and shoulders. If you see, all of these joints are weight bearing joints. They are very much responsible for all sorts of movement. Whatever movement you are making with your body, either upper part or lower part, these joints are involved there. That's why they are just one of the very important joints inside the body and responsible for all the major movements. These are affected first in osteonecrosis. Another side effect of use of medical steroids is on blood sugar metabolism. This is much more profound that we understand, and this side effect is present in persons whether they are diabetic or non-diabetic. In diabetic persons, this side effect is much more pronounced and it should be taken care of. When we see that there is raised blood sugar, it has a pattern. If you look at the fasting blood sugar, it rises to some extent. But if you look at the postprandial blood sugar that we have after 2 hours of having the meals, then there is much more like aggressive negative effect of use of steroids on blood sugar. So this is very important, and this is present in both diabetic persons and non-diabetic persons. That's why you see that in diabetic persons, this kind of sharp rise in postprandial blood sugar warrants the urgent management of that from the medical side. Another important side effect is that diffuse weakness. We see that there is weakening of the bones, there is weakening of the muscles gradually, and this develops in the long term with a kind of weakness inside the body, a feeling of weakness, lack of strength, and it is associated mostly with mid-term and long-term use of steroids, and you are not able to find any particular reason for it. It is just very vague and very diffuse. So when persons are using steroids, they can also check this point. Another very important side effect is the weight gain. There is a pattern of weight gain when someone is using steroids, and it has 3 characteristics. And it is evident when someone is using steroids for mid-term or long-term. And you see, generally there is a moon face, a kind of like swelling over the face. If you see this person, the face of this person is very long, but you can see very easily that there is some sort of round face, some sort of swelling there. So this is very common when someone is using steroids. And there had been one very funny medical speculation during this present time of Russia-Ukraine war. So what happened, some of the medical experts from United States, they pointed out that President Putin might be taking lot of steroids. That's why he was having very like moon face, very characteristic of like heavy dosage of steroids. This is simply some medical speculation, and from the United States, some experts, you can think that they might guess it, and it can be right or not. I can't say just anything about that. Another very characteristic symptom of weight gain associated with the use of steroids is belly fat. You will see that body is experiencing a kind of starvation, and it has started to store good quantity of fat in the belly area, in the abdominal area. So this is very, very characteristic with the use of steroids. Third, it is also, you can see buffalo hump. You will see deposition of fat in the neck area and upper back area. It's very common. So it's also present with the long-term use of steroids. This is very, very important topic, disruption of HPA axis. If we look at it, it is one of the central, you can say, neurohormonal system inside our body. It includes hypothalamus, it includes pituitary gland inside the brain and adrenal. Some neurochemicals they secrete out of hypothalamus, then they affect pituitary, then they affect the adrenal gland, and this is the normal way of secreting hormones. This type of axis is present in other endocrinal glands also, but it's very important. We know that proper functioning of this axis is very important for the generation of many hormones by the adrenal. And when someone is taking steroids, at that time, there is disruption of HPA axis, and it can present with a variety of symptoms. Different persons, they can experience a wide variety of symptoms. That's why it's always suggested that you start, you modify, you taper off, you stop the use of steroids only after having proper medical advice. You should always take steroids under experience, under qualified medical supervision. This is very, very important. I have many clients of IBDs. There had been one client with Crohn's disease, very qualified person from just normal standards. So he mentioned that he was experiencing some kind of like triggering of the symptoms, and doctors gave him 10 milligram of steroids. So it was Visolone. So he told me that suddenly he experienced just very good. He felt as if there is no problem. So this is the way that they are working, even though they are suppressing like immunity, having lot of side effects, but immediately they are giving very good relief as anti-inflammatory agents, and they also start to disrupt the HPA axis. We will cover the HPA axis in another video in very good detail. Another side effect, it's more common in children. Many persons think that when steroids are used by children, they are not having children's or kids, they are not having lot of side effects. This is not true. Even kids are having lot of side effects when they use steroids for mid-term to long term. Generally, it should be avoided. The use of steroids should be avoided in kids when they are having that type of disorder, if we have to use them mid-term or long-term. What happens, we have already seen that steroids affect the end part of the bones first. This part of the bone is very important for the growth in young children and kids. When that part is affected, there is impairment in the growth in young children. This is very, very common with the use of steroids. That's why it is becoming somewhat a norm in many countries that in managing IBDs or other autoimmune disorders, doctors are preferring stronger immunosuppressants, the third line of medical drugs, instead of first using steroids. Or another approach can be to use steroids for the like mid-term, for a like short-term therapy, and then they switch over to something else. So this is becoming very, very common, and because children and kids are also having very strong side effects. Another important side effect that is present in adolescents is delayed puberty. We see that with puberty there is development of secondary sexual characteristics in both boys and girls. Boys are having bounce take, some hairs in the body parts, pubic hairs, hoarseness of the voice, and girls are also having some changes inside the body, in their breast area, in their voice, and particularly start of the menstruation. So generally, like in some persons, it can cause lot of hormonal issues during this very specific adolescent times, and girls can also experience lot of menstrual problems, menstrual irregularities, PMS like symptoms. So it's very common. And another side effect that's very important for you to understand, and it is when someone is using steroids for any length of time, there is immunosuppression inside body. Our immunity, it gets suppressed, and this is one of the action, one of the activities of medical steroids, one of the intentions. That's why it's given in autoimmune disorders. So there is always high risk of mild, moderate, or severe infection. You see, many times, persons who got kidney transplants, they are always suggested that you have to be in very hygienic condition. You avoid social gathering, you avoid going out, you avoid the normal surroundings that can have some sort of infection. You should avoid all types of food from outside that could attract some infection inside the body. The same is true with lesser intensity for every person who is using steroid, because they have a just great susceptibility to attract any sort of infection from outside, and we call it secondary infection many times, that is associated with the use of steroids. It can be bacterial, it can be fungal, it can be viral also. Another important consideration here is the delayed manifestation of symptoms. We see that there are two main activities of steroids. One is immunosuppressant, we have covered it. Another one is anti-inflammatory activity. That's why, because of both of these reasons, steroids are used in the management of autoimmune disorders. So when there is anti-inflammatory activity, what happens when you have some infection from outside? It causes some sort of inflammation inside the body. When a normal person attracts that type of infection, it always manifests in some sort of symptoms like pain, swelling, loss of functioning. But when that person is using steroid, these symptoms are masked for some time. But underground, if you consider the situation, actual situation of the body parts, they are having worsening of the infection. That's why this is very important. When you are using steroids, even if you have infection, you have attracted infection, you will not be experiencing these symptoms quite early. There will be delay, and during that time that infection has a chance to go up. That's why you should manage it as early as you just find some clue of infection. Another important consideration is the cardiovascular system. When we are using steroids, this is very important system, and it affects, the use of steroids affect every part of the cardiovascular system. So we have already seen that there is weight gain associated with the use of steroids. This is not purely gain of the fat. There is breakdown of the protein. We see in the muscles, we see thinning of the bones, loss of minerals, and there is fluid retention. The weight gain is, you can say, in the long term, it is a kind of deposition of the fat as well as fluid retention. In short to mid-term, it is mostly fluid retention. And this is very, very important. When we say fluid retention, this is the pseudo weight. This is the most disturbing type of weight gain. Even if it is 1 kg or 2 kg of weight gain, it is very, very problematic. This kind of fluid retention, or like it is actually the swelling inside our body, retention of the fluids or electrolyte imbalance. If you see, there are some effects with the use of steroids on cardiovascular system. You can see the face, there is some swelling there. On the ankles also, there is some swelling. There is hypertension, more tendency to have higher blood pressure. There is tendency for atherosclerosis. So there is danger of having plaques or blockages inside the vessel. So all of this is associated with mid-term and long-term use of steroids. You have to be careful about it. So many persons who are 40 plus, 50 plus, when they are using steroids, they are much more prone to develop these problems, these complications associated with steroids. Another one is skin. Generally, there is a tendency as skin is having very profuse blood supply. So skin is one of the most sensitive organs, particularly against the use of steroids. It reflects the effect of steroids like very early. You can experience these side effects. The prominent side effect here that is associated with mid-term to long-term usage is thinning of the skin. If we see, skin is also having some like protein and some fat, and we see that protein part that it breaks down. If you just pinch the skin and you look at it, you will find that it is thinning. This is very, very evident. Many times when persons are using steroids, they are not aware of this side effect. They simply feel, what's happening to my skin? It is just becoming very thin, very just feeble. So this is the side effect of like steroids. Medically, we call it atrophy of the skin. Another one is development of hairs in female body parts that are not generally there, over face or any other parts of the body. They are not having generally like thick hairs like men. So this is because of the hormonal imbalance caused by the steroids. It's very, very common. Another one is acne, or a kind of acne and a kind of like erythema. This is very localized many times and sometimes spread over several layers. It can be over face, over neck, over chest, or over arms, sometimes over thigh. So this is like present in the with the usage of steroids. Another one, it is, even though we consider hair as the like dead part, but you see that the part of the hair that is growing at the root, it is the living part. It is something living. That's why you will find thinning of the hair. It can break, the end part of the hair is splitting into two, and overall like there can be like, you can call it like premature falling of the hair when they are becoming thin. This is also associated with the like long-term use of steroids. Another very important point is delayed healing of wounds. We see that there is anti-inflammatory effect. There is immunosuppressing effect with the use of steroids. When we are saying immunosuppressants, this is causing the delay in the healing of wounds when you are using steroids. And in persons who are diabetic, this becomes much more pronounced. Diabetic persons, they have a tendency of delayed healing of wounds. This becomes much more like prominent when they are also using steroids for any reason. So it's very important. If there is some diabetic person, he is having some wound and also using steroids, they should be very, very just cautious about managing their smaller injury. This can just this otherwise it can go on for a longer period of time. Another like very important effect is on the eye health. So generally we see that cataract and visual impairment is generally a feature that is found that is related with the aging process. It's present mainly in the seniors who are 50 plus, 60 plus or 70 plus. It's very common, cataract and visual impairment. And in diabetic persons also, all these three like cataract, glaucoma, is increased pressure inside the eyeball, and problem with the retina or the deteriorating health of the retina, it is causing visual impairment. In diabetic persons, these symptoms, these can be present at younger age if blood sugar is not managed properly. And when some person is using steroids for mid-term and long-term, they are becoming more and more susceptible for these conditions. And definitely you can see that when there is comorbidity, you are having autoimmune disorder and taking medicines for that, and you are taking steroids for that, and at the same time you are having diabetes or any other like chronic disorder, then it becomes very tough for you. You are much more susceptible for these type of problems. That's why just whenever you are having these type of problems, you put all your focus to manage it properly. Better try to manage it naturally and holistically. It will definitely help you in the long run. Another important consideration, or you can say this is very just someone can experience it very early. This is the digestive upset. Very simply, this is the digestive upset. When someone is using steroids, they can experience some sort of hyperacidity, nausea, vomiting, sometimes bloating, sometimes little bit of diarrhea. These are common digestive upsets. But associated with the use of steroid is another important side effect. This is the development of ulcer inside stomach and duodenum, and it can lead to bleeding. Generally, it is associated with mid to long-term use of steroids or with very high dosage of steroids, even in short term. So you have to be aware of it. There are many persons who are having inflammatory bowel disease, celiac disease, particularly if you consider Crohn's disease, that can have lot of inflammation inside the stomach and duodenum. At that time, if you are using steroids, you are having greater chance of developing ulcers, or you can say ulcers and bleeding. So you have to be very careful when you are having Crohn's disease. It becomes very important. And when someone is using steroids and at that time he has to take some sort of medical painkiller drugs, NSAIDs normally just available, and many times doctors also prescribe them. Some of the NSAIDs are available over the counter also. So at that time you have 4 times more risk of having ulcers inside the stomach and duodenum, and of having bleeding inside stomach and duodenum. So you have to be aware about this fact. Another important consideration is the fatty liver. It is associated with mid-term and long-term use of steroids. It's very common problem. We see that body is in starvation phase and it is just depositing lot of the fat inside the abdomen, in the belly area, and this is very important, fatty liver. And in some persons who are using steroids for very long time and in sufficiently high dosage, there is chance, or there is like greater possibility to have cirrhosis of liver. This is a very serious condition, and it's better to diagnose both of these, fatty liver and cirrhosis of liver, as early as possible. Many persons who are receiving treatment from me for IBDs, I'm providing Ayurvedic treatment, so I'm just very well aware of it. Many times they are already having like digestive symptoms because of the IBDs. and we generally don't consider fatty liver condition in them. But this is very, very important. When someone is receiving like medical treatment or Ayurvedic treatment for like IBDs, they need to monitor for the liver health at least every 2 to 3 years. Even if they are younger, they are below 40 years of the age. This is very, very important. Another important side effect is the pancreatitis. This is again very problematic to diagnose in IBDs and celiac disease. What happens many times, the symptoms of pancreatitis are being masked by the symptoms of the IBDs or celiac disease. That's why you have to be very watchful, and you can definitely you should always be in constant touch with your medical expert, and they will be able just to guide you to have some tests if they are required. So it's very important and very serious problem if you are having it, and particularly when you have it with any other serious condition of the digestive system, then it becomes tough to manage both of them. That's why just it's very good to get it identified as soon as possible, get it diagnosed as soon as possible. Another rare like complication, just at first I want to omit it, but this is an informative video for your education. It's very important when someone is using steroids for the long term. At that time, there is possibility of the visceral perforation. There can be perforation inside gastrointestinal tract, and that can attract very serious. You will definitely be hospitalized, receive proper treatment for that. Sometimes there might be need for the surgery. So it should always be like initially there can be very strong pain in the abdomen, so you should always take care of it. Many times what happens, persons who are having like IBD or celiac disease, they experience that type of very strong pain, and they simply just increase the dose of steroids themselves. This could be fatal. It's very important to seek the medical advice. So even if you are not having this type of serious complication, there is no possibility of it. But if you are just visiting the medical expert and getting advice from it, it could be life-saving if there is just little possibility that you have already attracted this type of complication. So it's very important. Another one, this we have talked lot of bad stuff about steroids. I just I simply consider steroids as another medical drug. They are not very different. If you study medicine, every chemical it is having some effect on the body, and we should know about it, and we can just evaluate the benefit and risk ratio. This is the way medical experts are prescribing it, and there is nothing wrong with it. One good thing that is associated with the use of steroids is feeling better. When you start to use it for first few days, you experience that everything is becoming better. It is not like some physiological healing or something. This is the mental euphoria. You have a sense that I'm becoming very, very good. I am enjoying. I am just having a kind of pleasure or happiness. So this type of feeling is associated when someone is using steroids in first few days only. Like it's not present even just for like 6 weeks or 12 weeks. This is for just very small period of time. Another like Another side effect associated with mid-term and long-term use of steroids is anxiety, nervousness. People become much more prone to have this type of like nervousness, brooding over something, some type of like thinking process always going on inside mind, worried about little things, becoming irritated. You can see that lot of things are going on inside our body, inside our mind when we are using steroids. So it's very, very common associated with mid and long term use of steroids. Another one is as the use of steroid is also impacting the HPA axis and many other like hormones inside the body. So it is interfering with the sleeping pattern. It can be that you are not just when you lie in the bed, you are not able to go to sleep properly, or even if you go to sleep, you have to wake up several times. So you have some very strong and vivid dreams. They are disturbing the sleep. So any type of thing can happen with persons, and women can experience it much more profoundly during some specific part of the menstrual cycle. So it's related with the hormonal process, further aggravating that condition in the females. And this is again, visceral perforation is a rare complication. It could be present in persons. Similarly, psychosis is also a rare complication. You should not consider it a norm. Even after, like, there is certain group of person, there is a category of persons who are more susceptible to develop this type of rare complication. Persons who are having very just major depression or any type of like strong anxiety, they are receiving medical drugs for that. And persons who have very just very, you can say, very high degree of insomnia, they are receiving medical pills for that. Or persons who are having MDI, maniac depressive illness, bipolar disorders, those type of persons have a greater chance to experience this type of like maniac or psychosis problem, and it can be present in short term. So at that time, the only possibility, the only effective way to just stop these type of symptoms is to stop the use of the steroids. There had been no therapy that had been effective for these type of symptoms. So just you have to be aware of it. If someone is using steroids and they are experiencing just some lot of stuff is going inside mind, they just find it very, very difficult, they should tell doctor. He will definitely, he can consider. Remember, it is a rare side effect of steroid. It can happen with anybody, but there is a category of persons who are more susceptible to develop it. So this is the way I have provided you, I am providing you some of the references. When we are talking about something like it's very simple, very simple in the like YouTube community that many persons they say anything about anything. So there is no censorship. But when I'm an Ayurveda doctor, I provide people Ayurvedic treatment. I have modern medical education also. So it's very important when you are saying something, it should be backed with some references, with some evidences, and you can find some information about that in some standard medical texts. That's why I thought that it is important to share some of the references here about the side effects of the steroids. So these are the references. Again, I say, I have already said that the purpose of this video is to make you aware, make you well informed about the side effects of the steroids. I'm an Ayurveda doctor. I'm providing Ayurvedic treatment for chronic disorders and autoimmune disorders. I will say you, when you are adopting holistic and natural therapies such as Ayurvedic herbs in the management of these disorders, initially you use them as the core therapy. You are using medical treatment also under medical supervision, and at that time you start with Ayurvedic treatment also. So what happens that as if you are taking Ayurvedic herbs under proper supervision, you start to have some relief. It's very natural and gradual. There is nothing magical about it, nothing that can be just very, very dramatic relief. You start to attract some benefit of it within 1 month. If someone is already taking immunosuppressants or steroids, then this can be 2 or 3 months period that you feel that you are moving in the right direction. You are having some benefit with the Ayurvedic treatment. At that time, you are using Ayurveda as the core therapy, and over a long period of time, it can be 1 year, 2 years, or much more in some persons who are in very complicated stage. You will be able to taper off medical drugs, stronger medical drugs. There will be no need. And we can evaluate your conditions with some medical test also, that from inside your body, that you are experiencing a real remission. It is not just some relief in the symptoms, outer symptoms. The like inner problem is also being resolved. It happens with most people who are taking Ayurveda for sufficient period of time. So at that time, you start to move on the path of healing and cure. This healing energy is inside you. Ayurvedic treatment, Ayurvedic therapy simply helps to kindle it, helps to support this natural healing energy. Then you start to have it. On top of it, we are having a program, Embrace Ayurveda and Yoga. It helps you to use the information of Ayurveda and Yoga in your daily life within a short period of time. You use that information practically in your life, and it helps you much more rapidly to move in the direction of vibrant health, in the direction of healing and cure. So I will say thank you for watching this video. Embrace Ayurveda and Yoga in your daily life. Have vibrant health, greater happiness now and always. Thank you. Namaste, Dr. Vikramaditya Tomar.